This is a 72-year-old gentleman with a history of previous surgery from L4 to S1. That's solidly fused. That was done in an outside facility, but then developed adjacent level degeneration with spondylolisthesis and stenosis. You can see on the MRI that the anterolisthesis reduces back and everything's lined up when you lay down, but when you stand up, it slides forward. And because of this forward and backward slippage back and forth, the disc starts to degenerate and get worn down. As that happens, you develop stenosis. You can see how narrow the spinal canal is, and then there's excessive fluid in the facet joints, similar to my arthritic knee when I overdo it. It's a true joint that develops fluid when there's irritation. And you can see how much stenosis there is. So we'll perform a minimally invasive lateral lumbar interbody reconstruction infusion that'll allow us to really jack up this space, pull it back into a more normal position, indirectly decompress the nerves, and then treat the arthritis by preventing these bones from grinding back and forth. We'll do a minimally invasive lateral lumbar interbody reconstruction infusion using computer navigation through small 1-inch incisions.
Awesome.
It's 105, so
I have the 110 blade.
all right, put up the 110. I won't know.
That might be the other picture.
Not only that, we do a lot of breathing and implant tools.
Yeah, we do. A lot of
Me,
complex.
Paul, and Remy.
Yeah.
Girls got a right to change their mind.
You don't want to be that.
Okay, I think I want to start with a 6 style.
Okay.
What are you pulling out there, Dr. Tim?
This is all the degenerated disc. It is very caca-poo-poo.
Is that the medical term?
Yes, that's the official medical term for a disc that looks this fragmented, this degenerated, and this dysfunctional. I think you're going to feel a lot better after surgery. All right, the discectomy's done. It went perfectly. That disc was caca-poo-poo like we discussed. Putting in this implant. Once it goes in, it will jack up like a car jack and make a perfect fit.
Awesome.
Should have gone at 55 on him. Ooh, that feels good. Alrighty, I am now putting in the screws using navigation. It's cheating, but like my mama always said, if you don't cheat every once in a while, you ain't trying hard enough. Going in beautifully. And for $1 million, you too could have a navigation set. Very good bone. These screws are getting a very good bite. It's going to be a very solid construct.
What do you got there, Dr. Tim?
I have the rod now on an articulating inserter. So it'll go down these rod sleeves. When they get to the bottom, it will slowly angle up as I pass it through, and that will go to the distal rod sleeve. Through these rod sleeves, I'll pass the nut down, lock it down, and then break off these rod sleeves, and like magic, this rod will be tightened down to the nuts in the spine.
Awesome. How'd the case go, Dr. Tim?
It went perfectly. I'm so happy. Especially since this is one of our family members. But I think you'll be able to appreciate from the x-rays. It looks really good. I'm really happy.
Should he expect to be 4 or 5 inches taller?
I hope so.
Get well.